and welcome to Medical Dialogues. I'm Roshneeta. Let's look at today's top health news. Breaking news on NEET 2024 results: NTA to withdraw grace marks for 1,563 candidates. The Union Government and NTA have decided to cancel the grace marks awarded to 1,563 NEET UG 2024 candidates due to the time lost during the exam. The students will be informed of their original scores without the grace marks via email. They can either retain their original marks or opt for a re-examination. The Supreme Court took note of this decision and disposed of the plea regarding the grace marks issue. The re-exam for the 1,563 affected students is scheduled for 23rd of June, with results to be published before June 30th to allow for the counselling process starting on 6th of July. This decision came after the NTA's panel concluded that awarding compensatory marks resulted in a skewed situation. All referrals should be documented in patients' medical records. DGHS issues guidelines for inter-departmental referrals at hospitals. DGHS issues guidelines for inter-departmental referrals. The DGHS has released new guidelines to standardize inter-departmental referrals within hospitals. These guidelines aim to improve the patient care by ensuring clear, consistent, and accountable referral processes. Hospitals are encouraged to develop internal SOPs based on these guidelines. The guidelines that addresses the significant variability, inconsistencies, and lack of accountability in current referral processes, which can harm patients. Issues such as poor communication, unclear procedures, non-standardized formats, and inadequate training for healthcare professionals are common. The DGHS emphasizes that a robust referral policy is essential for comprehensive patient care, as many patients have multiple comorbidities requiring multidisciplinary cooperation. The key elements of the guidelines include that general principles for referral, do's and don'ts for interdepartmental referrals, handling special situations like referral denial, patient non-attendance, and urgent or emergent referrals, pro forma for referral forms, post-referral advice and nursing staff registers, an indicative list of medical conditions classified as immediate, urgent, or routine. The guidelines highlight that effective referral mechanisms enhance diagnostic accuracy, treatment effectiveness, and continuity of care. Viagra may improve brain functions, prevent dementia, according to an Oxford study. Sildenafil, widely known by its brand name Viagra, may offer benefits beyond treating erectile dysfunction. Recent research suggests it can help prevent memory-related problems by increasing cerebral blood flow and enhancing blood vessel function in those at risk of vascular dementia. Vascular dementia impacts cognitive functions like memory, reasoning, and judgment due to reduced blood supply to the brain, damaging brain tissue. Unlike Alzheimer's disease, where amyloid beta plaques block neuron connectivity, vascular dementia arises from obstructions in blood vessels leading to brain cell damage. A study by scientists at the University of Oxford, published in Circulation Research, highlights the potential of sildenafil in the fight against dementia. In India, the burden of vascular cognitive impairment and dementia is substantial, with about 5.3 million dementia patients, 40% of whom suffer from vascular dementia. The findings from the Oxford study are particularly relevant in this context, offering hope for a new treatment avenue. Dr. Manjari Tripathi, head of the Neurology Department at AIIMS, highlighted several risk factors for vascular dementia, including high BP, smoking, diabetes, hypertension, obesity, obstructive sleep apnea, and atherosclerosis. Vascular dementia can manifest in different forms, such as multi-infarct dementia resulting from multiple small strokes, and strategic infarct dementia, which can occur from a single stroke in a critical brain area. Experts emphasize the need for comprehensive multicentric trials to validate these findings. While researchers stressed the necessity of further studies, the potential of sildenafil in treating vascular dementia represents a significant step forward in dementia research. Why one should stop watching so much of TV? It affects how you age, new study says. Swapping TV time for physical activity might not sound like most enjoyable trait, but is linked to significantly better chances of healthy aging, according to a new study. The research, led by Dr. Molin Wang from Harvard's T. Chi Chan School of Public Health, emphasizes the benefits of replacing sedentary behaviors with light physical activity, moderate to vigorous physical activity, and adequate sleep. The study analyzed data from over 45,000 participants of the Nurses' Health Study who were 50 or older in 1992 and free of chronic disease. Over 20 years, researchers tracked their sitting habits, physical activity, and aging outcomes. Healthy aging was defined as living to at least 70 years old without major chronic diseases and maintaining good memory, physical health, and mental health. Results showed that each additional 2 hours of TV watching was associated with a 12% decrease in healthy aging, while 2 hours of light physical activity at work increased the odds of healthy aging by 6%. Dr. Andrew Freeman from National Jewish Health, not involved in the study, noted that sedentary behaviors like prolonged TV watching are linked to worse health outcomes. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.